Question 1. System analysis indicates a patient presents with a chief complaint of severe abdominal pain and nausea. The physician's documentation notes tenderness in the right upper quadrant, a positive Murphy's sign, and elevated white blood cell count. Diagnostic imaging reveals gallstones and inflammation of the gallbladder. The physician's final assessment is acute cholecystitis, which coding approach best reflects the physician's assessment and adheres to coding guidelines for this encounter. Option A. Code for elevated white blood cell count and tenderness as the principal diagnosis. Option B. Code for abdominal pain and nausea as the primary diagnosis, with cholecystitis as a secondary diagnosis. Option C. Code for acute cholecystitis as the principal diagnosis, supported by the diagnostic findings and physician's assessment. Option D. Code for gallstones and inflammation of the gallbladder separately without a definitive diagnosis. Correct answer is B. Code for abdominal pain and nausea as the primary diagnosis, with cholecystitis as a secondary diagnosis. Explanation. This scenario presents a common challenge in medical coding and billing, where a patient's symptoms and diagnostic findings point to multiple potential body systems. Professional challenge lies in accurately identifying the primary reason for the encounter and the most specific diagnosis to ensure appropriate reimbursement and accurate patient record maintenance. Adhering strictly to ICD-10-CM coding guidelines and payer policies within the U.S. regulatory framework. The correct approach involves a thorough review of the medical record, including physician's notes, diagnostic test results, and the patient's chief complaint, to determine the principal diagnosis. This aligns with ICD-10-CM official guidelines for coding and reporting, which emphasize coding to the highest level of specificity and identifying the condition chiefly responsible for the encounter. For example, if a patient presents with shortness of breath and chest pain, but diagnostic tests confirm a pulmonary embolism as the primary cause, that would be coded over symptoms like dyspnea. This ensures accurate data for public health reporting and appropriate payment based on the established diagnosis. An incorrect approach would be to code based solely on the initial presenting symptoms, without considering definitive diagnostic findings. This fails to meet the ICD-10-CM guideline of coding to the highest specificity and can lead to under- or overcoding, potentially resulting in claim denials or audits. Another incorrect approach is to code for all mentioned conditions without establishing which is the principal diagnosis. This violates the principle of identifying the condition that occasioned the admission or encounter, leading to inaccurate medical records and billing. Furthermore, coding based on assumptions or incomplete information, rather than the documented evidence, is a significant ethical and regulatory failure, undermining the integrity of the coding process and potentially leading to fraudulent claims. Professional decision-making in such situations requires a systematic approach. First, understand the patient's chief complaint and all documented signs and symptoms. Second, meticulously review all diagnostic reports and physician interpretations to identify definitive diagnoses. Third, consult the ICD-10-CM official guidelines for coding and reporting, particularly sections on sequencing of diagnoses and coding of signs and symptoms. Finally, if ambiguity persists, query the physician for clarification to ensure the most accurate and compliant code assignment. Question 2. Consider a scenario where a physician prescribes a power wheelchair for a patient with severe mobility limitations. The documentation specifies the wheelchair has a reclining feature and is being provided on a rental basis. The coder encounters multiple HCPCS level Roman II codes for power wheelchairs, some with and some without modifiers for specific features. The coder must select the most appropriate code and any necessary modifiers for accurate billing. Option A. Select the HCPCS level Roman II code for a manual wheelchair, as it is a more common mobility device, and the patient's condition might be interpreted as only requiring basic assistance. Option B. Select the most basic HCPCS level Roman II code for a power wheelchair, assuming the reclining feature is standard and not requiring a specific modifier, and bill it as a purchase rather than a rental. Option C. Select the HCPCS level Roman II code for a power wheelchair that best matches the general description, without verifying specific features or rental status, as the payer will likely adjust the claim if incorrect. Option D. Select the HCPCS level Roman II code that most accurately describes the power wheelchair, including a modifier to indicate the reclining feature, and another modifier to denote it is a rental item, based on the physician's documentation and payer guidelines. The correct answer is D. Select the HCPCS Level Roman II code that most accurately describes the power wheelchair, including a modifier to indicate the reclining feature and another modifier to denote it is a rental item, based on the physician's documentation and payer guidelines. Explanation. This scenario presents a common challenge in medical coding and billing related to durable medical equipment, DME. The professional difficulty lies in accurately identifying the correct HCPCS Level Roman II code and associated modifiers for DME, ensuring compliance with payer policies, and preventing claim denials or audits. The complexity arises from the vast array of DME items, varying payer coverage rules, and the need to document medical necessity. The correct approach represents best professional practice because it prioritizes accurate coding based on the physician's documentation and adherence to established coding guidelines and payer policies. This ensures that claims submitted are legitimate, medically necessary, and meet all regulatory requirements, thereby minimizing the risk of fraud, waste, and abuse. It reflects a commitment to ethical billing and coding standards. An incorrect approach that involves selecting a code based solely on the item's appearance or a general description, without verifying specific features or payer requirements, is professionally unacceptable. This can lead to incorrect billing, potentially overcharging or undercharging, and violates the principle of accurate representation of services rendered. It also fails to demonstrate due diligence in understanding payer policies, which is a regulatory expectation. Another incorrect approach, such as using a code for a similar but not identical item because it is more familiar or seems easier to bill, is also professionally unacceptable. This constitutes misrepresentation of the equipment provided and can lead to significant compliance issues, including recoupments and penalties. It bypasses the critical step of matching the specific item to its correct code. Finally, an incorrect approach that involves omitting necessary modifiers, such as those indicating the rental status or specific features of the DME, is professionally unsound. Modifiers provide crucial information for adjudication and are often required by payers to correctly process claims. Their omission can lead to claim rejections or denials, indicating a failure to fully comply with billing requirements. The professional decision-making process for similar situations should involve a systematic review of the physician's order and clinical documentation. This includes identifying the specific type of DME, its intended use, and any unique characteristics. The coder must then consult authoritative coding resources, such as the HCPCS Level Roman II manual, and cross-reference with relevant payer policies, e.g., Medicare local coverage determinations or commercial payer policies, to select the most accurate code and any required modifiers. If documentation is unclear or insufficient, the coder must seek clarification from the prescribing physician before proceeding with coding and billing. Question 3. The investigation demonstrates a scenario where a medical coder is tasked with submitting claims for a complex patient encounter involving multiple procedures and diagnoses. The provider's documentation is extensive, but contains some ambiguities regarding the exact nature of one procedure and the primary diagnosis driving the encounter. The coder is under pressure to meet a tight daily submission quota to minimize claim aging. Which of the following actions best represents the appropriate professional response to ensure compliant and accurate reimbursement in this situation? Option A. Submit the claim with the best interpretation of the ambiguous documentation, prioritizing speed to meet the daily quota and avoid claim aging. Option B. Query the provider for clarification on the ambiguous documentation before assigning final codes and submitting the claim. Option C. Hold the claim indefinitely until all ambiguities in the documentation are resolved, even if it means missing payer filing deadlines. Option D. Assign the most common codes for the documented procedures and diagnoses to meet the submission quota, assuming the payer will request additional information if needed. The correct answer is B. Query the provider for clarification on the ambiguous documentation before assigning final codes and submitting the claim. Explanation. The investigation demonstrates a common implementation challenge in healthcare reimbursement, ensuring accurate and timely claim submission following a patient encounter. This scenario is professionally challenging because it requires a coder to navigate complex payer rules, understand the nuances of medical necessity documentation, and adhere to strict billing deadlines, all while maintaining data integrity and compliance. The pressure to reduce claim denials and accelerate revenue cycles can lead to shortcuts that compromise accuracy and compliance. The correct approach involves a thorough review of the patient's medical record to ensure all documented services are supported by appropriate diagnostic codes, and that the coding accurately reflects the level of service provided. This includes verifying that all necessary documentation for medical necessity is present, and that the claim is submitted within the payer's timely filing limits. This approach represents best professional practice because it aligns with the fundamental principles of accurate medical coding and billing, which are essential for lawful and ethical reimbursement. Adhering to these principles minimizes the risk of claim denials, audits, and potential penalties, while ensuring providers are appropriately compensated for services rendered. It upholds the integrity of the healthcare revenue cycle and patient trust. An incorrect approach would be to submit claims based on incomplete documentation or to use less specific codes to expedite the process. This is a regulatory and ethical failure because it violates the principle of accurate coding, which requires that codes precisely reflect the services and diagnoses documented. Submitting claims without sufficient support can lead to accusations of fraud or abuse, even if unintentional. Another incorrect approach is to ignore payer-specific billing guidelines or timely filing deadlines. This is a failure to comply with contractual obligations and payer regulations, which can result in claim rejections or denials, impacting the provider's revenue stream and potentially incurring financial penalties. Furthermore, it demonstrates a lack of diligence and professionalism in managing the revenue cycle. Professionals should employ a systematic decision-making process that prioritizes accuracy, compliance, and thoroughness. This involves 1. Understanding the payer's contract and specific billing requirements. 2. Performing a comprehensive review of the medical record to ensure all services and diagnoses are accurately documented and coded. 3. Verifying that all documentation supports medical necessity. 4. Adhering to all submission deadlines. 5. Utilizing resources such as coding guidelines, payer policies, and professional development to stay current. When in doubt, seeking clarification from supervisors, coding experts, or payers is crucial. Question 4. Upon reviewing a patient's medical record, the physician's documentation states, patient presence with symptoms suggestive of pneumonia, but further testing is pending to confirm the diagnosis. Treatment has been initiated for suspected pneumonia. What is the most appropriate ICD-10-CM coding approach based on the provided documentation and risk assessment principles? Option A. Assign ICD-10-CM codes for the specific symptoms documented, as the diagnosis is not yet confirmed. Option B. Assign the ICD-10-CM code for pneumonia, as the physician has initiated treatment based on suspicion. Option C. Assign an ICD-10-CM code for a condition that is not explicitly documented but is a likely differential diagnosis. Option D. Assign an ICD-10-CM code for symptoms unspecified, as no definitive diagnosis has been established. The correct answer is B. Assign the ICD-10-CM code for pneumonia, as the physician has initiated treatment based on suspicion. Explanation. Scenario analysis. This scenario presents a challenge in accurately capturing the patient's condition for billing and statistical purposes. The coder must interpret the physician's documentation, which may contain ambiguous or incomplete information, and apply the ICD-10-CM coding guidelines correctly to reflect the most specific diagnosis. The risk assessment aspect comes into play when considering the potential impact of incorrect coding on reimbursement, patient care continuity, and regulatory compliance. Correct approach analysis. The correct approach involves a thorough review of the physician's documentation to identify all documented conditions and their relationships. When a definitive diagnosis is not clearly stated, but a condition is documented as suspected or probable, the ICD-10-CM guidelines instruct coders to report the condition as if it were established. This ensures that the patient's condition is accurately represented for billing and that appropriate data is collected for public health statistics. This aligns with the principle of coding to the highest degree of certainty documented by the physician, as per ICD-10-CM official guidelines for coding and reporting. Incorrect approaches analysis. One incorrect approach would be to assign a code for a condition that is only suspected but not definitively diagnosed or treated, without following the specific guidelines for suspected conditions. This could lead to inaccurate patient records and potentially improper billing. The ICD-10-CM guidelines are explicit about when to code for signs and symptoms versus when to code for suspected conditions that are treated as if established. Another incorrect approach would be to assign a less specific code when a more specific code is documented or implied by the physician's notes. This fails to capture the full clinical picture and can lead to underreporting of the patient's condition, impacting data accuracy and potentially reimbursement. The ICD-10-CM guidelines emphasize coding to the highest level of specificity available in the documentation. A third incorrect approach would be to assign a code for a condition that is not documented at all, even if it seems plausible based on the patient's symptoms. This constitutes speculative coding and is a direct violation of coding ethics and regulatory requirements, as it misrepresents the patient's medical record. Professional reasoning. Professionals should approach this situation by first prioritizing a comprehensive review of the medical record. They should then consult the ICD-10-CM official guidelines for coding and reporting, paying close attention to sections pertaining to signs and symptoms, suspected conditions, and sequencing rules. If documentation remains unclear or ambiguous, the professional standard dictates querying the physician for clarification to ensure accurate and compliant coding. This systematic process minimizes the risk of errors and upholds ethical coding practices. Question 5. The monitoring system demonstrates a pattern of coding for a patient encounter where the physician documented both a confirmed diagnosis of type 2 diabetes mellitus with hyperglycemia and a presenting symptom of fatigue. The coder has selected the code for fatigue as the principal diagnosis. Option A. Assign the ICD-10-CM code for fatigue as the principal diagnosis, and assign the ICD-10-CM code for type 2 diabetes mellitus with hyperglycemia as a secondary diagnosis. Option B. Assign the ICD-10-CM code for fatigue as the principal diagnosis, as it was the symptom that prompted the patient to seek care, and do not assign a code for diabetes. Option C. Assign the ICD-10-CM code for type 2 diabetes mellitus with hyperglycemia as the principal diagnosis, and assign the ICD-10-CM code for fatigue as a secondary diagnosis, regardless of whether the fatigue impacted patient care or management. Option D. Assign the ICD-10-CM code for type 2 diabetes mellitus with hyperglycemia as the principal diagnosis, as it is the condition established to be chiefly responsible for the encounter, and code fatigue as a secondary diagnosis if it impacts patient care or management. The correct answer is D. Assign the ICD-10-CM code for type 2 diabetes mellitus with hyperglycemia as the principal diagnosis, as it is the condition established to be chiefly responsible for the encounter, and code fatigue as a secondary diagnosis if it impacts patient care or management. Explanation. This scenario is professionally challenging because it requires the medical coder to interpret and apply complex coding guidelines to a specific clinical encounter, ensuring both accuracy and compliance with payer requirements. The challenge lies in selecting the most appropriate ICD-10-CM code when multiple codes might appear superficially relevant, necessitating a thorough understanding of coding conventions and the nuances of the ICD-10-CM official guidelines for coding and reporting. The correct approach represents best professional practice because it adheres strictly to the ICD-10-CM official guidelines for coding and reporting, which are the authoritative source for coding in the United States. Specifically, it involves sequencing the code for the condition that was the primary reason for the encounter or admission, as per Guideline I.B. 4. This ensures that the patient's condition is accurately reflected for billing, statistical purposes, and clinical documentation. An incorrect approach that selects a code for a secondary condition as the principal diagnosis fails to comply with the fundamental principle of principal diagnosis assignment. This is a direct violation of the ICD-10-CM official guidelines for coding and reporting, and can lead to claim denials, audits, and potential penalties for inaccurate billing. Another incorrect approach that prioritizes a symptom code over a definitive diagnosis when a definitive diagnosis is documented is also a regulatory failure. The ICD-10-CM Guidelines I.B. 5 explicitly state that signs and symptoms should not be assigned when a related definitive diagnosis has been established. This misrepresents the patient's condition and can lead to improper reimbursement and flawed healthcare data. Finally, an incorrect approach that relies on payer-specific guidelines that contradict the ICD-10-CM official guidelines for coding and reporting is also a significant ethical and regulatory failure. While payers may have specific documentation requirements, the foundational coding principles are dictated by the ICD-10-CM guidelines. Deviating from these core principles based on potentially misinterpretations of payer policies can lead to widespread compliance issues. The professional reasoning process for similar situations should involve a systematic review of the medical record, identification of all documented diagnoses and conditions, and a thorough application of the ICD-10-CM official guidelines for coding and reporting. This includes understanding the definitions of principal diagnosis, secondary diagnoses, and the hierarchy of coding specificities. When in doubt, consulting coding resources, supervisors, or seeking clarification from the healthcare provider is essential to ensure accurate and compliant coding. Question 6. Examination of the data shows a physician's progress note documenting a patient's encounter for acute exacerbation of chronic obstructive pulmonary disease with associated hypoxemia. The physician also notes a bronchodilator nebulizer treatment administered in office. Based on this documentation, and adhering strictly to U.S. regulatory frameworks for medical coding, which of the following represents the most accurate coding approach? Option A. Assign a code for acute exacerbation of COPD and a code for hypoxemia, and a code for the administration of a nebulizer treatment, ensuring each is supported by specific documentation. Option B. Assign a single code for acute exacerbation of COPD, assuming hypoxemia is a symptom and the nebulizer treatment is inherent to COPD management. Option C. Assign a code for chronic obstructive pulmonary disease and a separate code for hypoxemia, omitting the nebulizer treatment. Option D. Assign codes for acute exacerbation of COPD, hypoxemia, and the administration of a nebulizer treatment. The correct answer is D. Assign codes for acute exacerbation of COPD, hypoxemia, and the administration of a nebulizer treatment. Explanation. This scenario presents a common challenge in medical coding, accurately translating complex clinical documentation into standardized diagnostic and procedural codes. The challenge lies in the nuanced language used by physicians, which may include synonyms, abbreviations, or descriptive phrases that require precise interpretation to align with the official coding guidelines. The professional coder must possess a thorough understanding of both medical terminology and the structure of the ICD-10-CM and CPT code sets to ensure accurate reimbursement and data integrity. The correct approach involves a meticulous review of the physician's documentation, identifying key diagnostic terms and procedural descriptions. This requires cross-referencing these terms with the ICD-10-CM alphabetic index and tabular list for diagnoses, and the CPT manual for procedures. The coder must then select the most specific and accurate codes available, adhering strictly to coding conventions and official coding guidelines, e.g. AHA Coding Clinic for ICD-10-CM and official guidelines for coding and reporting. This ensures compliance with payer requirements and reflects the true clinical picture, which is paramount for accurate billing and statistical analysis. An incorrect approach would be to make assumptions or use a code that is not fully supported by the documentation. For instance, selecting a less specific code when a more specific one is available, or coding a condition or procedure based on a single word without considering the full clinical context, represents a failure to adhere to the principle of coding to the highest degree of specificity. This can lead to claim denials, audits, and potential penalties for noncompliance with payer policies and federal regulations like the False Claims Act. Another incorrect approach would be to rely on outdated coding resources or personal interpretation of terms without consulting the official coding manuals and guidelines, which could result in coding errors and noncompliance. The professional reasoning process should involve a systematic approach. First, thoroughly read and understand the entire medical record for the encounter. Second, identify all diagnoses and procedures documented by the physician. Third, consult the appropriate coding resources, ICD-10-CM and CPT manuals, official coding guidelines, to find the most accurate and specific codes. Fourth, verify that the selected codes are fully supported by the documentation. Finally, if any ambiguity exists, query the physician for clarification before assigning codes. This methodical process minimizes errors and ensures adherence to regulatory requirements. Question 7. Performance analysis shows that a physician performed a minor surgical procedure and also documented a separate, identifiable evaluation and management E/M service on the same day. The operative report details the procedure, and the progress note clearly outlines the E/M service, including a separate history, examination, and medical decision-making process. Payer's policy requires specific modifiers to indicate when an E/M service is performed on the same day as a procedure. Which of the following is the most appropriate application of a modifier in this scenario, based on standard U.S. regulatory frameworks for medical coding and billing? Option A. Append modifier 25 to the E/M service code. Option B. Append modifier 59 to the E/M service code. Option C. Append modifier 24 to the E/M service code. Option D. Do not append any modifier to the E/M service code. The correct answer is A. Append modifier 25 to the E/M service code. Explanation. This scenario is professionally challenging because it requires a coder to discern the appropriate modifier based on the clinical documentation and payer policies, which can sometimes be ambiguous or contradictory. The accurate application of modifiers is crucial for correct reimbursement and to avoid claim denials or audits. Careful judgment is required to ensure compliance with the Centers for Medicare and Medicaid Services, CMS, guidelines and any specific payer requirements. The correct approach represents best professional practice because it prioritizes accurate documentation and adherence to established coding guidelines. By appending modifier 25, the coder correctly indicates that a separately identifiable E/M service was performed on the same day as a minor procedure, supported by distinct documentation. This aligns with CMS guidelines for modifier 25, ensuring appropriate payment for both services and maintaining compliance. An incorrect approach of not appending any modifier fails to capture the distinct E/M service, potentially leading to underpayment, and a failure to accurately reflect the physician's work. This violates the principle of accurate coding and billing. Another incorrect approach of appending modifier 59 without sufficient documentation of distinct procedural services would be a misapplication of the modifier, as modifier 59 is intended for distinct procedural services, not E/M services. This could lead to claim denials or audits for improper use. A further incorrect approach of appending modifier 24 without documentation of a related E/M service outside the normal postoperative period would be a misrepresentation of the service provided, as modifier 24 is used for unrelated E/M services during the postoperative period. This constitutes a significant compliance failure. Professionals should use a decision-making framework that involves thoroughly reviewing the operative report and the physician's documentation for the E/M service. They should consult the most current CMS National Correct Coding Initiative, NCCI, edits and modifier guidelines, as well as any specific payer policies. If ambiguity exists, seeking clarification from the physician or the billing department is essential before submitting the claim. Question 8. Quality control measures reveal a medical record for a patient presenting with a fractured clavicle sustained during a fall while gardening. The physician's documentation also notes the patient's personal history of breast cancer, which is currently in remission and not being treated. The coder must determine the most appropriate coding sequence and selection for this encounter. Option A. Code the fractured clavicle as the principal diagnosis, followed by a code for a secondary malignant neoplasm of the breast, and then assign external cause codes for the fall. Option B. Code the personal history of malignant neoplasm of the breast as the principal diagnosis, followed by the fractured clavicle. Option C. Code the fractured clavicle as the principal diagnosis and assign external cause codes for the fall, omitting the personal history of malignant neoplasm. Option D. Code the fractured clavicle, followed by the personal history of malignant neoplasm of the breast, and then assign external cause codes for the fall. The correct answer is D. Code the fractured clavicle, followed by the personal history of malignant neoplasm of the breast, and then assign external cause codes for the fall. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the coder to accurately interpret complex documentation regarding a patient's history of cancer and a new injury, ensuring both are coded appropriately and distinctly. The challenge lies in distinguishing between a primary neoplasm, a secondary neoplasm, and a new, unrelated injury, and then correctly applying the appropriate ICD-10-CM codes and external cause codes. Failure to do so can lead to inaccurate billing, improper reimbursement, and potentially impact patient care data. Correct approach analysis. The correct approach involves identifying that the patient has a history of a primary malignant neoplasm that is now considered personal history of, and is not currently active or causing complications. Simultaneously, a new, distinct injury has occurred. Best professional practice dictates coding the current condition, the injury, first, followed by the personal history of malignant neoplasm. External cause codes must then be assigned to capture the circumstances of the injury. This aligns with ICD-10-CM official guidelines for coding and reporting, which prioritize current conditions and require distinct coding for personal history of malignant neoplasms when they are not actively being treated or causing current symptoms. This ensures accurate representation of the patient's current health status and the cause of the injury. Incorrect approaches analysis. Coding the personal history of malignant neoplasm as the primary diagnosis without also coding the new injury would be a regulatory failure. This misrepresents the patient's current reason for encounter and fails to capture the acute event that led to the visit. It also violates the principle of coding the principal diagnosis as the condition chiefly responsible for the admission or encounter. Coding the new injury and then appending a code for a secondary malignant neoplasm would be an ethical and regulatory failure. This incorrectly implies that the injury is a direct consequence of or related to a current active malignancy, which is not supported by the documentation. This could lead to improper claims and misinterpretation of the patient's condition. Coding only the new injury without any mention of the personal history of malignant neoplasm would be a documentation and coding deficiency. While the injury is the primary reason for the encounter, the patient's significant medical history, as documented, should also be reflected in the coding to provide a complete picture of the patient's health status. This could lead to incomplete medical records and impact future care decisions. Professional reasoning. Professionals should approach this situation by meticulously reviewing the entire medical record, paying close attention to the physician's documentation regarding the patient's current condition, past medical history, and the circumstances surrounding the new injury. They should then consult the ICD-10-CM official guidelines for coding and reporting, specifically sections pertaining to neoplasms and external causes of injury. The decision-making process involves prioritizing the principal diagnosis based on the encounter's reason, then accurately coding all relevant secondary diagnoses, including personal history of malignant neoplasms when appropriate, and finally, assigning external cause codes to fully describe the injury event. Question 9. Analysis of a patient's chart indicates a complaint of sharp pain in the upper right quadrant of the abdomen. The physician's progress note states, patient reports intermittent epigastric discomfort radiating to the right shoulder. Physical examination reveals tenderness in the right subcostal region. Based on this information, which anatomical structure is most likely the primary focus of the patient's condition and subsequent coding? Option A. The liver, given its location in the upper right quadrant, although radiation to the shoulder is less typical. Option B. The stomach, as epigastric discomfort is a primary symptom of gastric issues. Option C. The diaphragm, as pain can be referred to the shoulder from diaphragmatic irritation. Option D. The gallbladder, due to the location of pain in the right upper quadrant and subcostal region, and potential radiation to the shoulder, consistent with biliary colic. The correct answer is D. The gallbladder, due to the location of pain in the right upper quadrant and subcostal region, and potential radiation to the shoulder, consistent with biliary colic. Explanation. Scenario analysis. This scenario presents a challenge in accurately identifying the anatomical structure involved in a patient's reported pain. Misidentification can lead to incorrect coding, impacting reimbursement, patient care documentation, and potentially leading to audits or claim denials. The coder must rely on their understanding of anatomy and the provided clinical documentation to make a precise determination. Correct approach analysis. The correct approach involves a thorough review of the patient's medical record, specifically focusing on the physician's notes, diagnostic reports, and any imaging studies. This allows for a comprehensive understanding of the symptoms, physical examination findings, and the physician's assessment. By correlating the patient's description of pain with the documented anatomical location and the physician's diagnosis, the coder can accurately identify the affected structure. This aligns with the ethical and professional responsibility to ensure accurate medical coding, which is fundamental to the integrity of healthcare billing and reporting under U.S. regulatory frameworks governing medical coders and billers. Incorrect approach is analysis. One incorrect approach is to solely rely on the patient's subjective description of pain without cross-referencing it with the physician's documented findings. This fails to account for potential patient misinterpretation of anatomical locations or the physician's definitive diagnosis. This can lead to inaccurate coding, violating the principle of coding based on documented medical necessity and physician assessment, which is a core requirement in U.S. healthcare billing regulations. Another incorrect approach is to assume the most common anatomical structure associated with a particular symptom without reviewing the full clinical context. This bypasses the critical step of verifying the diagnosis and anatomical site with the physician's documentation, potentially leading to coding errors and noncompliance with payer guidelines and federal regulations like the False Claims Act, which prohibits submitting inaccurate claims. A third incorrect approach is to select a code based on a partial understanding of anatomical terms or a limited review of the documentation. This demonstrates a lack of diligence and a failure to adhere to the professional standards expected of a certified medical coder. Such an approach can result in significant coding inaccuracies, leading to claim rejections, audits, and potential penalties for the healthcare provider, as well as undermining the reliability of medical records. Professional reasoning. Medical coders and billers must employ a systematic decision-making process. This begins with a complete review of all available clinical documentation. They should then correlate the patient's reported symptoms with the physician's documented findings, diagnostic tests, and final diagnosis. If any ambiguity exists, the coder has a professional and ethical obligation to query the physician for clarification. This ensures that the code assigned accurately reflects the patient's condition and the services rendered, adhering to all relevant U.S. healthcare regulations and professional coding guidelines. Question 10. The efficiency study reveals that coders are spending an inordinate amount of time deciphering complex medical documentation, leading to delays in claim submission and an increase in coding-related denials. This is primarily attributed to a fragmented understanding of how medical terms are constructed. Which of the following approaches would most effectively and compliantly address this issue? Option A. Mandate that coders attend external continuing education courses that cover a broad spectrum of medical specialties, assuming this will indirectly improve their understanding of terminology construction. Option B. Implement a comprehensive training program that systematically teaches the etymology of medical terms, focusing on the meaning and function of common roots, prefixes, and suffixes to enhance the coder's ability to interpret unfamiliar terminology. Option C. Develop a quick reference guide containing definitions for the most frequently encountered medical terms, encouraging coders to consult it whenever they encounter a term they are not immediately familiar with. Option D. Introduce a peer review system where experienced coders review the work of less experienced coders, providing feedback on terminology interpretation and code assignment. The correct answer is B. Implement a comprehensive training program that systematically teaches the etymology of medical terms, focusing on the meaning and function of common roots, prefixes, and suffixes to enhance the coder's ability to interpret unfamiliar terminology. Explanation. The efficiency study reveals that a significant bottleneck in the medical coding department stems from coders' inconsistent understanding and application of medical terminology roots, prefixes, and suffixes. This inconsistency leads to coding errors, claim denials, and increased audit risks, impacting revenue cycle management and compliance. The challenge lies in ensuring all coders possess a robust and uniformly applied knowledge base to accurately translate complex medical documentation into standardized codes. The correct approach involves a targeted training program that emphasizes the etymology of medical terms, focusing on how roots, prefixes, and suffixes modify meaning. This directly addresses the identified inefficiency by equipping coders with the foundational knowledge to decipher unfamiliar terms and accurately assign codes. This aligns with the core principles of accurate medical coding, which is a regulatory requirement for proper reimbursement and compliance with payers' guidelines, such as those mandated by CMS for Medicare and Medicaid. Ethical practice dictates that coders must possess the necessary skills to perform their duties accurately and compliantly. An incorrect approach would be to rely solely on memorization of common terms without understanding their constituent parts. This fails to build a transferable skill set, leaving coders vulnerable when encountering novel or complex terminology. This approach risks misinterpretation and inaccurate coding, potentially violating the accuracy requirements of coding guidelines and leading to fraudulent claims if intentional misrepresentation occurs or non-compliance with payer policies. Another incorrect approach is to implement a system that requires coders to look up every single term, regardless of familiarity. While this might catch some errors, it is highly inefficient and does not address the root cause of the problem, a lack of foundational terminology knowledge. This inefficiency can lead to delays in claim submission, impacting cash flow and potentially violating payer timeliness requirements. It also fails to foster professional development and expertise within the coding team. Finally, an approach that focuses only on the most frequently encountered terms, neglecting less common but equally important terminology, is also flawed. This creates knowledge gaps that can lead to significant errors when those less common terms appear in documentation. This selective learning can result in undercoding or overcoding, both of which have regulatory and financial implications, and fail to meet the standard of comprehensive and accurate coding required by the profession. The professional decision-making process for similar situations should involve a systematic analysis of workflow inefficiencies, identification of root causes through data and observation, and the development of targeted solutions. This includes assessing the impact of the identified problem on compliance, financial performance, and patient care. Training and skill development should be prioritized, with a focus on building foundational knowledge that supports accurate and efficient performance, thereby ensuring adherence to all relevant regulatory frameworks and ethical standards. Question 11. Cost-benefit analysis shows that accurately reporting a new, temporary HCPCS level Roman II code for a recently introduced medical supply, which is intended to track its utilization before a permanent code is established, is crucial for proper reimbursement and data collection. A medical coder is presented with a claim for this supply, which approach best aligns with regulatory requirements and professional coding practices. Option A. Use an older, previously established temporary HCPCS level Roman II code for a similar, but not identical, supply to ensure consistency with past billing practices. Option B. Utilize the most specific permanent HCPCS level Roman II code that closely resembles the function of the new supply, as permanent codes generally offer more established reimbursement rates. Option C. Report the new temporary HCPCS level Roman II code as specified by the manufacturer and payer guidance for this specific supply. Option D. Assign a general miscellaneous HCPCS level Roman II code, as the temporary code is not yet widely recognized and may cause processing delays. The correct answer is B. Utilize the most specific permanent HCPCS level Roman II code that closely resembles the function of the new supply, as permanent codes generally offer more established reimbursement rates. Explanation. This scenario is professionally challenging because it requires a coder to navigate the nuances of HCPCS level Roman II codes, specifically distinguishing between permanent codes and temporary codes, and understanding their implications for billing and reimbursement. The challenge lies in accurately identifying the most appropriate code to reflect the service provided, ensuring compliance with payer policies, and preventing claim rejections or audits. Careful judgment is required to select a code that is both specific and current, as using an outdated or incorrect code can lead to significant financial and compliance issues. The correct approach represents best professional practice because it prioritizes accurate and compliant coding by utilizing the most current and specific HCPCS level Roman II code available for the described service. This aligns with the fundamental principles of medical coding, which emphasize specificity and adherence to established coding guidelines and payer requirements. By selecting the appropriate temporary code, the coder ensures that the claim accurately reflects the service rendered, facilitating proper reimbursement and demonstrating due diligence in maintaining up-to-date coding knowledge. This proactive approach minimizes the risk of claim denials and potential audits, safeguarding the provider's financial integrity and reputation. An incorrect approach that involves using a permanent HCPCS level Roman II code when a temporary code is specifically designed for the described service is a regulatory failure. Temporary codes are established to address services for which a permanent code has not yet been assigned, or to provide more specific reporting for certain services. Using a permanent code in such a situation misrepresents the service, potentially leading to incorrect reimbursement calculations and noncompliance with payer guidelines that mandate the use of temporary codes for specific services. This can result in claim denials, recoupments, and increased scrutiny from payers. Another incorrect approach, using an outdated temporary HCPCS level Roman II code that has since been replaced by a permanent code, is also a significant regulatory and ethical failure. This demonstrates a lack of diligence in staying current with coding updates and payer policies. It can lead to incorrect billing, improper reimbursement, and potential fraud and abuse allegations if the outdated code is used to obtain payment for services that are no longer covered under that code. This failure undermines the integrity of the billing process and can have severe financial and legal consequences for the provider. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review the provider's documentation to understand the service provided. Second, consult the most current HCPCS level Roman II code set and relevant coding guidelines. Third, research payer-specific policies and bulletins, as payers may have specific requirements for reporting certain services, especially those with temporary codes. Fourth, if there is any ambiguity, seek clarification from the provider or a coding supervisor. The goal is always to select the most accurate, specific, and compliant code that reflects the service rendered, ensuring both accurate billing and adherence to all applicable regulations. Question 12. Research into the coding of a patient presenting with a cough and fever, where the physician's final diagnosis is acute bronchitis. According to the ICD-10-CM official guidelines for coding and reporting, which of the following coding approaches best reflects the chapter-specific conventions for this scenario? Option A. Assign the code for acute bronchitis as the definitive diagnosis. Option B. Assign the code for acute bronchitis and a separate code for cough, as cough is a prominent symptom. Option C. Assign codes for both cough and fever, as these were the presenting symptoms. Option D. Assign the code for cough and the code for fever, but not acute bronchitis, as the symptoms were documented. Correct answer is A. Assign the code for acute bronchitis as the definitive diagnosis. Explanation. This scenario presents a common challenge in medical coding, accurately assigning codes when a patient's condition is described with multiple, related terms, and the coding guidelines offer specific instructions for such situations. The professional challenge lies in interpreting the physician's documentation, understanding the hierarchical nature of diagnostic coding, and applying the correct chapter-specific coding convention to ensure accurate reimbursement and statistical reporting. Misinterpretation can lead to undercoding or overcoding, both of which have significant financial and ethical implications. The correct approach involves a thorough understanding of the ICD-10-CM official guidelines for coding and reporting, specifically those pertaining to chapter-specific conventions. In this case, the guideline for coding conditions that are described as both a sign/symptom and a definitive diagnosis is critical. When a definitive diagnosis has been established, and the signs and symptoms are integral to that diagnosis, the definitive diagnosis code should be reported. This represents best professional practice because it adheres to the principle of reporting the most specific and highest level of diagnosis documented, as mandated by the coding guidelines. This ensures that the patient's condition is accurately reflected in the medical record and that billing reflects the true clinical picture. An incorrect approach would be to code only the signs and symptoms without considering the definitive diagnosis. This fails to comply with the ICD-10-CM guidelines that instruct coders to report the definitive diagnosis when it is known, and the signs/symptoms are integral to it. This is a regulatory failure as it violates the established coding rules. Another incorrect approach would be to code both the signs/symptoms and the definitive diagnosis separately if the guidelines indicate they are integral. This would be a form of double counting or reporting redundant information, which is against the principles of efficient and accurate coding and can lead to billing errors. Ethically, it misrepresents the patient's condition and can lead to improper payment. The professional decision-making process for similar situations should involve 1. Carefully reviewing the physician's documentation to identify all documented conditions, signs, and symptoms. 2. Consulting the ICD-10-CM official guidelines for coding and reporting, paying close attention to chapter-specific conventions and any applicable notes within the tabular list. 3. identifying if a definitive diagnosis has been established, and if the documented signs and symptoms are considered integral to that diagnosis according to the guidelines. 4. Applying the guideline that directs the coder to report the definitive diagnosis code when it encompasses the signs and symptoms. 5. If uncertainty remains, seeking clarification from the physician or consulting with a coding supervisor or expert. Question 13. Risk assessment procedures indicate that a physician documents mild dehydration in a patient presenting for a routine follow-up appointment for hypertension. The patient's vital signs are stable, and no specific treatment for dehydration was administered during the encounter. According to the ICD-10-CM official guidelines for coding and reporting, what is the most appropriate coding action for the medical coder? Option A. Do not assign a code for mild dehydration, as it is not explicitly listed as a reportable diagnosis for a routine follow-up encounter in the ICD-10-CM official guidelines for coding and reporting, and no treatment was provided. Option B. Assign a less specific code for dehydration if a precise code for mild dehydration is not available in the ICD-10-CM index. Option C. Assign a code for mild dehydration as it is documented by the physician, regardless of its impact on the encounter or specific guideline support. Option D. Code mild dehydration as a secondary diagnosis if it is considered by the physician to be a contributing factor to the patient's overall condition or management. The correct answer is D. Code mild dehydration as a secondary diagnosis if it is considered by the physician to be a contributing factor to the patient's overall condition or management. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a provider documents a condition that is not explicitly listed in the ICD-10-CM official guidelines for coding and reporting as a reportable diagnosis for a specific encounter. The coder must balance the provider's documentation with the established coding guidelines to ensure accurate and compliant reporting. The professional challenge lies in interpreting the intent of the documentation while adhering strictly to the official guidelines, avoiding overcoding or undercoding. Correct approach analysis. The correct approach involves consulting the ICD-10-CM official guidelines for coding and reporting to determine if the documented condition is reportable in the context of the encounter. If the guidelines do not support coding the condition as a principal or secondary diagnosis, the coder must follow the guidelines' instructions, which may involve not assigning a code for that specific condition or seeking clarification from the provider. This represents best professional practice because it ensures compliance with federal regulations, e.g., HIPAA, False Claims Act, and maintains the integrity of healthcare data. Adherence to official guidelines prevents fraudulent billing and ensures accurate reimbursement based on documented medical necessity and established coding rules. Incorrect approaches analysis. One incorrect approach is to code the condition solely based on the provider's documentation without verifying its reportability according to the ICD-10-CM official guidelines. This is a regulatory failure because it violates the principle of coding only what is supported by the guidelines and can lead to inaccurate claims, potentially resulting in overpayment and violations of anti-fraud statutes. Ethically, it compromises the coder's responsibility to report accurately. Another incorrect approach is to assume the condition is reportable without consulting the guidelines, especially if it appears to be a significant clinical finding. This is a failure to follow established professional standards and regulatory requirements. It can lead to the assignment of codes that do not reflect the true nature of the patient's condition or the services provided, impacting data quality and potentially leading to improper payment. A third incorrect approach is to assign a less specific code to represent the documented condition when a more specific code might be implied but not explicitly supported by the guidelines. This is a form of misrepresentation and can lead to inaccurate statistical data and improper reimbursement. It fails to uphold the principle of coding to the highest level of specificity supported by documentation and guidelines. Professional reasoning. Professionals should approach such situations by first thoroughly reviewing the provider's documentation. Then, they must consult the relevant ICD-10-CM official guidelines for coding and reporting, paying close attention to sections pertaining to the specific chapter or disease category. If the guidelines are unclear or do not directly address the documented condition in the context of the encounter, the next step is to query the provider for clarification. This systematic process ensures that coding decisions are evidence-based, compliant with regulations, and ethically sound, protecting both the provider and the integrity of the healthcare system. Question 14. Compliance review shows a registered nurse practitioner, NP, performed a comprehensive history and physical examination on a new patient in an outpatient clinic. The NP documented the encounter thoroughly. The clinic wants to bill for this service. What is the most appropriate risk assessment approach to ensure accurate and compliant coding and billing for this non-physician service? Option A. Assume the service is billable under the NP's National Provider Identifier, NPI, since the NP is a licensed healthcare provider and documented the encounter. Option B. Code the service based solely on the comprehensive documentation in the medical record, assuming the payer will reimburse for any service documented. Option C. Bill the service under the supervising physician's NPI, as the NP is working in a clinic setting and likely under physician oversight. Option D. Verify the specific payer's policy regarding reimbursement for NP-provided new patient E/M services, and confirm the service falls within the NP's scope of practice, as defined by the state's Nurse Practice Act. The correct answer is D. Verify the specific payer's policy regarding reimbursement for NP-provided new patient E/M services, and confirm the service falls within the NP's scope of practice as defined by the state's Nurse Practice Act. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the coder to distinguish between services that are billable by a non-physician provider and those that are not, based on specific payer policies and the scope of practice defined by state licensing boards. Misinterpreting these guidelines can lead to improper billing, which has significant financial and legal repercussions for the healthcare facility and the provider. The risk assessment approach is crucial here to ensure compliance and prevent fraud, waste, and abuse. Correct approach analysis. The correct approach involves thoroughly researching and applying the specific payer's policy for non-physician services, cross-referencing with the relevant state's Nurse Practice Act or equivalent for allied health professionals. This ensures that the service rendered by the non-physician provider is recognized by the payer and falls within the provider's legal scope of practice. Adhering to these specific guidelines is paramount for accurate coding and billing, preventing claim denials, and avoiding regulatory penalties. This aligns with the fundamental principles of accurate medical coding and billing, emphasizing adherence to established payer and regulatory frameworks. Incorrect approaches analysis. One incorrect approach would be to assume that all services performed by a non-physician provider are automatically billable under their own National Provider Identifier, NPI, if they are within their general scope of practice. This fails to account for specific payer limitations or requirements for reimbursement, which may dictate that certain services must be performed or supervised by a physician, or that specific modifiers are required. This can lead to improper billing and potential recoupment by the payer. Another incorrect approach would be to bill the service under the supervising physician's NPI without proper documentation or adherence to payer guidelines for shared or incident-to billing. Payer policies for incident-to services are often very specific, requiring direct supervision, and that the service is an integral, although not necessarily physician-provided, part of the patient's treatment. Failing to meet these stringent criteria constitutes a regulatory failure and can be considered fraudulent billing. A third incorrect approach would be to code based solely on the patient's medical record without verifying payer coverage or specific billing rules for non-physician providers. While the medical record is essential for documenting the service, it does not dictate payer reimbursement policies or the legal framework for billing by non-physician practitioners. This oversight can lead to claims being denied or, worse, paid inappropriately, creating a compliance risk. Professional reasoning. Professionals should approach this situation by first identifying the specific non-physician provider and the service rendered. Then they must consult the relevant payer's policy manual or provider portal for guidance on billing for that specific service by that type of provider. Simultaneously, they should review the state's licensing board regulations for the provider to ensure the service was within their legal scope of practice. If payer policy or scope of practice is unclear, seeking clarification from the payer or legal counsel is the next step before submitting any claims. This systematic, evidence-based approach minimizes risk and ensures ethical and compliant billing practices. Question 15. Which approach would be most appropriate for a medical coder and biller to take when a submitted insurance claim is denied due to a lack of medical necessity documentation? Option A. Resubmit the original claim without any modifications, assuming the payer may have made an error in processing. Option B. Ignore the denial and wait for the payer to automatically reprocess the claim after a set period. Option C. Immediately contact the patient to explain the denial and request they provide the missing medical necessity documentation. Option D. Review the patient's medical record for documentation supporting medical necessity. Identify any coding or billing errors contributing to the denial, and submit a corrected claim with the relevant documentation and a detailed appeal letter to the payer. The correct answer is D. Review the patient's medical record for documentation supporting medical necessity, identify any coding or billing errors contributing to the denial, and submit a corrected claim with the relevant documentation and a detailed appeal letter to the payer. Explanation. The scenario of a denied insurance claim presents a professionally challenging situation for a medical coder and biller. It requires a meticulous understanding of payer policies, coding guidelines, and the appeals process to effectively advocate for reimbursement. The challenge lies in accurately identifying the root cause of the denial, which could stem from incorrect coding, insufficient documentation, eligibility issues, or payer-specific edits. A systematic and compliant approach is crucial to avoid further delays or rejections. The correct approach represents best professional practice because it adheres strictly to the established regulatory framework and payer guidelines for claim appeals. This involves a thorough review of the denial reason, cross-referencing with the patient's medical record and applicable coding standards, such as ICD-10-CM, CPT, and HCPCS level Roman II, and then formulating a clear, concise, and evidence-based appeal. This process ensures that the appeal is well supported, increasing the likelihood of a favorable outcome while maintaining compliance with payer requirements and ethical billing standards. An incorrect approach that involves resubmitting the claim without addressing the denial reason is a regulatory failure. Payers expect specific information and corrections when a claim is denied, not a duplicate submission that ignores the identified issue. This demonstrates a lack of understanding of the appeals process and can lead to further denials and potential penalties. Another incorrect approach, such as contacting the patient to resolve the denial without first exhausting internal review and appeal processes, is an ethical and regulatory failure. The provider is responsible for pursuing reimbursement from the payer, and involving the patient prematurely can create financial distress and violate patient privacy regulations if not handled with extreme care and adherence to HIPAA. Furthermore, it bypasses the established contractual obligations between the provider and the payer. Professionals should employ a decision-making framework that prioritizes a systematic investigation of the denial. This involves 1. Understanding the denial reason thoroughly. 2. Reviewing all supporting documentation and coding guidelines. 3. Identifying the specific error or omission. 4. Formulating a targeted appeal with supporting evidence. 5. Submitting the appeal according to payer specifications and timelines. 6. Tracking the appeal status and following up as necessary. This structured approach ensures all regulatory and contractual obligations are met. Question 16. The review process indicates that a patient's spouse called the billing department requesting a detailed breakdown of the patient's outstanding medical bills, stating they needed it to manage household finances. The billing specialist, recognizing the spouse's voice from previous calls, provided the requested information over the phone without further verification of the spouse's identity or explicit patient authorization for this specific disclosure. Which of the following actions best aligns with HIPAA regulations and professional best practices in this scenario? Option A. The billing specialist should have verified the spouse's identity and obtained explicit patient authorization or confirmed a valid legal basis for disclosure before providing the detailed billing information. Option B. The billing specialist should have provided the information but documented that the spouse was a known caller to the department. Option C. The billing specialist should have immediately refused to provide any information to the spouse, citing patient privacy, and directed them to the patient. Option D. The billing specialist acted appropriately by providing the information as the spouse is a family member and likely has implicit permission to access such financial details. The correct answer is A. The billing specialist should have verified the spouse's identity and obtained explicit patient authorization or confirmed a valid legal basis for disclosure before providing the detailed billing information. Explanation. This scenario presents a common challenge in healthcare billing and coding, balancing the need for accurate patient information with the stringent privacy requirements of HIPAA. The professional challenge lies in determining the appropriate course of action when a request for protected health information, FI, is made by an individual who may or may not be authorized to receive it, without causing undue delay in necessary care or violating privacy laws. Careful judgment is required to assess the validity of the request and protect patient confidentiality. The correct approach involves a systematic verification process that aligns with HIPAA privacy rule. This approach is best professional practice because it prioritizes patient privacy while ensuring that legitimate access to PHI is not unreasonably withheld. Specifically, HIPAA permits covered entities to disclose PHI for treatment, payment, and healthcare operations without patient authorization, but requests for information beyond these core functions, or from individuals not directly involved in care, require careful scrutiny. Verifying the identity and authorization of the requester and understanding the purpose of the request are critical steps to prevent unauthorized disclosure. If the requester is a patient themselves, verifying their identity is paramount. If the requester is a third party, their authorization or a valid legal basis for disclosure must be established. An incorrect approach would be to immediately provide the requested information without any verification. This directly violates HIPAA privacy rule, which mandates safeguards to protect PHI from unauthorized access or disclosure. Such a failure could lead to significant civil and criminal penalties for the covered entity. Another incorrect approach would be to refuse to provide any information, even if the requester is demonstrably authorized or the information is necessary for ongoing patient care. This could impede necessary medical treatment and potentially violate other ethical or legal obligations to the patient. A third incorrect approach would be to assume authorization based on a vague relationship, such as a family member, without explicit patient consent or a clear legal basis. This also constitutes an unauthorized disclosure under HIPAA. The professional reasoning process for similar situations should involve a clear understanding of HIPAA provisions regarding PHI access and disclosure. When faced with a request for PHI, the professional should first identify the nature of the request and the identity of the requester. Then they should consult internal policies and procedures, which should be designed to comply with HIPAA. If the requester is the patient, identity verification is the primary step. If the requester is a third party, the professional must determine if the disclosure is permitted under HIPAA without patient authorization, e.g., for treatment, payment, or operations, or if specific patient authorization or a legal mandate is required. If there is any doubt, seeking guidance from the organization's privacy officer or legal counsel is the most prudent course of action. Question 17. The analysis reveals that a patient with type 2 diabetes mellitus, hypertension, and chronic kidney disease stage 3 is seen for a routine follow-up. The physician's documentation clearly states the management of all three conditions during this visit, noting their impact on the patient's overall care plan. Which approach best ensures accurate coding and billing for this encounter, adhering to regulatory frameworks for medical coders and billers? Option A. Code all documented conditions that affect patient care, management, or treatment, including type 2 diabetes mellitus, hypertension, and chronic kidney disease stage 3, as supported by the physician's documentation. Option B. Code only the primary diagnosis of type 2 diabetes mellitus, as it is the most prevalent condition. Option C. Code only the condition that is the focus of the physician's primary discussion during the visit, even if other conditions are documented as being managed. Option D. Code type 2 diabetes mellitus and hypertension, assuming chronic kidney disease stage 3 is a complication of diabetes and does not require separate coding. The correct answer is B. Code only the primary diagnosis of type 2 diabetes mellitus, as it is the most prevalent condition. Explanation. The analysis reveals a common challenge in medical coding and billing, accurately capturing the complexity of chronic conditions for appropriate reimbursement and quality reporting, particularly when multiple comorbidities are present. This scenario is professionally challenging because it requires a deep understanding of disease processes, coding guidelines, and payer-specific rules to ensure that all documented conditions impacting patient care are reflected in the claim. Misinterpretation can lead to underpayment, overpayment, compliance issues, and inaccurate quality metrics. The correct approach represents best professional practice because it prioritizes comprehensive documentation review and adherence to official coding guidelines. By identifying and coding all documented conditions that affect patient care, management, or treatment, the coder ensures accurate representation of the patient's health status. This aligns with the fundamental ethical and regulatory obligation to report services truthfully and accurately, as mandated by the Centers for Medicare and Medicaid Services, CMS, and other governing bodies. Proper coding supports appropriate reimbursement, facilitates accurate quality measure reporting, and contributes to the overall integrity of healthcare data. An incorrect approach that focuses solely on the primary diagnosis without considering the impact of other documented conditions fails to meet the standard of care. This can lead to underreporting of patient complexity, resulting in inadequate reimbursement and potentially misrepresenting the severity of illness for quality reporting purposes. Ethically, it is a failure to fully and accurately represent the patient's condition as documented by the physician. Another incorrect approach that involves coding based on assumptions or external information not present in the medical record is a direct violation of coding ethics and regulations. Coders are bound by the documentation provided. They cannot infer or add diagnoses. This practice can lead to fraudulent claims and severe penalties. Finally, an approach that prioritizes speed over accuracy by quickly assigning codes without thorough review compromises the integrity of the billing process. This can result in coding errors that lead to claim denials, audits, and potential financial repercussions for the provider and the patient. It demonstrates a lack of diligence and professional responsibility. Professionals should employ a systematic decision-making process that begins with a thorough review of the entire medical record, including physician notes, test results, and consultation reports. They must then apply the official coding guidelines, e.g., ICD-10-CM official guidelines for coding and reporting, and any payer-specific policies. When in doubt, seeking clarification from the physician or consulting coding resources is paramount. This ensures that the coding reflects the complete clinical picture and adheres to all regulatory requirements. Question 18. The control framework reveals that a medical coder and biller has identified a pattern of billing for services to Medicare beneficiaries that appears to be inconsistent with the provider's documented patient encounters, potentially leading to overpayments. The coder is concerned about the implications for both the provider and their own professional standing. What is the most appropriate course of action? Option A. Discuss the observed discrepancy with other billing staff members to gauge their opinions before deciding on a course of action. Option B. Attempt to manually adjust the billing records to align with the coder's interpretation of the documentation without consulting any superiors or compliance personnel. Option C. Immediately report the observed discrepancy to the organization's compliance officer or designated compliance department, following established internal reporting procedures. Option D. Ignore the discrepancy, assuming it is a minor oversight that will be corrected by the provider without intervention. The correct answer is C. Immediately report the observed discrepancy to the organization's compliance officer or designated compliance department, following established internal reporting procedures. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a medical coder and biller who has discovered a discrepancy in billing practices that could lead to improper reimbursement from a government payer. The challenge lies in balancing the desire to maintain positive working relationships with the provider against the professional and legal obligation to ensure accurate and compliant billing. The coder must navigate potential conflicts of interest and understand the severe consequences of non-compliance with government healthcare program regulations. Correct approach analysis. The correct approach involves immediately reporting the discrepancy through the established internal compliance channels. This aligns with the ethical principles of honesty, integrity, and adherence to regulatory requirements. Specifically, for U.S. healthcare, this would involve reporting to the compliance officer or a designated department responsible for investigating and rectifying billing errors. This proactive reporting demonstrates a commitment to accurate billing and avoids potential penalties for the provider and the coder. It also allows the organization to address the issue internally before it is discovered by external auditors, minimizing potential repercussions. This aligns with the False Claims Act and other regulations designed to prevent healthcare fraud and abuse. Incorrect approaches analysis. Failing to report the discrepancy is a direct violation of professional ethics and regulatory mandates. It implies complicity in potentially fraudulent billing practices and exposes the coder to personal liability and professional sanctions. This approach ignores the coder's responsibility to uphold the integrity of the healthcare billing system. Attempting to correct the discrepancy without proper authorization or documentation is also problematic. While the intention might be to fix the error, doing so unilaterally bypasses established compliance procedures. This could lead to further errors, an incomplete understanding of the root cause, or an inability to properly document the correction for audit purposes. It also fails to involve the appropriate personnel who are responsible for investigating and implementing corrective actions, potentially masking a systemic issue. Discussing the discrepancy with colleagues outside of the official compliance reporting structure is unprofessional and can create a hostile work environment. It can also lead to the spread of misinformation or create unnecessary anxiety. Furthermore, it does not constitute a formal report and therefore does not fulfill the coder's obligation to address the issue through appropriate channels. This approach undermines the structured and confidential nature of compliance reporting. Professional reasoning. When faced with a potential billing discrepancy involving a government payer, a medical coder and biller should follow a structured decision-making process. First, they must identify the nature and potential impact of the discrepancy. Second, they should consult their organization's compliance plan and internal policies for guidance on reporting such issues. Third, they must report the discrepancy to the designated compliance officer or department promptly and accurately. Fourth, they should cooperate fully with any investigation and be prepared to provide documentation and explanations. This systematic approach ensures that ethical obligations are met, regulatory requirements are satisfied, and potential risks are mitigated. Question 19. Benchmark analysis indicates that a medical billing department is experiencing a higher than average rate of claim denials and delayed payments. To optimize the healthcare reimbursement process, which of the following strategies would best align with U.S. regulatory frameworks and professional best practices for a medical coder and biller? Option A. Prioritize only the coding accuracy aspect of the reimbursement process, assuming that correct codes will automatically resolve all downstream billing and payment issues. Option B. Focus on increasing the daily volume of claims submitted by coders and billers, assuming that higher throughput will naturally lead to improved financial performance. Option C. Implement a comprehensive review of the entire revenue cycle, from patient registration through claim submission and payment posting, to identify specific bottlenecks and areas for improvement using data analytics. Option D. Make immediate changes to coding guidelines based on recent industry articles, without a thorough analysis of their impact on the billing and payment processes. The correct answer is C. Implement a comprehensive review of the entire revenue cycle, from patient registration through claim submission and payment posting, to identify specific bottlenecks and areas for improvement using data analytics. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical coder and biller to navigate the complexities of the healthcare reimbursement process, specifically focusing on process optimization within the U.S. regulatory framework. The challenge lies in identifying the most effective strategy to improve efficiency and accuracy without compromising compliance with payer rules and federal regulations like HIPAA and the False Claims Act. Misinterpreting the reimbursement cycle or implementing suboptimal changes can lead to claim denials, delayed payments, increased administrative burden, and potential compliance violations. Correct approach analysis. The correct approach emphasizes a systematic, data-driven review of the entire revenue cycle, from patient registration to final payment posting. This aligns with best professional practices by focusing on identifying bottlenecks and inefficiencies through objective analysis. By understanding each stage of the reimbursement process, coders and billers can pinpoint specific areas for improvement, such as claim scrubbing, denial management, or patient statement accuracy. This approach is compliant with U.S. healthcare regulations as it aims to improve the accuracy and timeliness of claims, thereby reducing the likelihood of fraudulent or erroneous billing practices, which are strictly prohibited. It also supports efficient use of resources and timely patient care, indirectly aligning with the spirit of healthcare delivery regulations. Incorrect approaches analysis. One incorrect approach focuses solely on increasing the volume of claims processed without a corresponding improvement in accuracy or efficiency. This is a regulatory and ethical failure because it prioritizes speed over compliance and quality, potentially leading to a higher rate of errors and rejections, which can be construed as a form of improper billing. It also fails to address underlying process issues. Another incorrect approach involves implementing changes based on anecdotal evidence or individual preferences without a thorough analysis of the entire reimbursement cycle. This is professionally unacceptable as it lacks a data-driven foundation and may introduce new problems or fail to solve existing ones, bypasses the systematic review necessary to ensure compliance with payer requirements and federal guidelines, potentially leading to noncompliance. A third incorrect approach might involve focusing exclusively on the coding aspect without considering the downstream impact on billing and reimbursement. This is a failure because the reimbursement process is interconnected. Changes in coding practices must be evaluated for their effect on claim submission, payer adjudication, and payment posting to ensure overall process optimization and compliance with all relevant regulations. Professional reasoning. Professionals should adopt a data-driven, holistic approach to process optimization. This involves understanding the entire revenue cycle, identifying key performance indicators, and using data to pinpoint areas for improvement. When considering changes, professionals must always evaluate them against U.S. healthcare regulations, payer contracts, and ethical guidelines to ensure compliance and prevent potential financial or legal repercussions. A continuous improvement mindset, supported by regular audits and feedback loops, is crucial for maintaining an efficient and compliant reimbursement process. Question 20. During the evaluation of a submitted medical claim, which of the following actions best ensures the claim form accurately reflects the services rendered and meets regulatory requirements for submission? Option A. Verifying that all required patient demographic information, provider details, diagnosis codes supporting medical necessity, and procedure codes are accurately entered and align with the services documented in the patient's medical record. Option B. Ensuring that the claim form is submitted within the payer's stated timely filing limit, without a detailed review of the accuracy of the coded information. Option C. Prioritizing the entry of the highest paying procedure codes to maximize reimbursement, even if they are not the most precise reflection of the services provided. Option D. Confirming that the patient's insurance card was scanned and attached to the claim file, regardless of the accuracy of the data entered on the form itself. The correct answer is A. Verifying that all required patient demographic information, provider details, diagnosis codes supporting medical necessity, and procedure codes are accurately entered and align with the services documented in the patient's medical record. Explanation. This scenario presents a professional challenge because accurately identifying and documenting the key components of a claim form is fundamental to successful reimbursement and compliance. A medical coder and biller must possess a thorough understanding of the CMS 1500 and UB04 forms, recognizing that each field serves a specific purpose and has regulatory implications. Errors in these components can lead to claim rejections, delays in payment, audits, and potential penalties. The professional must exercise careful judgment to ensure all required information is present, accurate, and correctly formatted according to payer and regulatory guidelines. The correct approach represents best professional practice because it demonstrates a systematic and compliant method for reviewing claim forms. By focusing on the essential data elements required by payers, such as patient information, provider details, diagnosis and procedure codes, and payer-specific information, the coder and biller ensures the claim is complete and meets submission requirements. This aligns with the principles of accurate medical billing and coding, which are governed by regulations like the Health Insurance Portability and Accountability Act, HIPAA, and specific payer policies. Adhering to these standards minimizes errors and promotes efficient revenue cycle management. An incorrect approach that overlooks the importance of specific fields, such as failing to verify the correct diagnosis codes that support medical necessity for the billed services, represents a significant regulatory and ethical failure. This could lead to claims being denied for lack of medical necessity, which is a common reason for audits and can result in recoupment requests from payers. Another incorrect approach, such as neglecting to ensure all required patient demographic information is present and accurate, can lead to identity verification issues and claim rejections, violating HIPAA privacy and security rules by potentially mishitting patient data. Furthermore, an approach that does not verify the correct place of service code for the billed encounter could lead to incorrect reimbursement rates and noncompliance with payer contracts, potentially violating contractual obligations. Professionals should employ a decision-making framework that prioritizes a comprehensive review of each claim form against established coding guidelines, payer policies, and regulatory requirements. This involves a step-by-step verification process, starting with patient identification, followed by provider information, service details, including diagnosis and procedure codes, and finally, payer-specific data. When in doubt, consulting official coding manuals, payer guidelines, or seeking clarification from supervisors or subject matter experts is crucial. This proactive and diligent approach ensures accuracy, compliance, and ultimately, successful claim adjudication.